John, welcome back. Today we're going to talk about how we treat neuropathy at Gonstead Physical Medicine. At Gonstead Physical Medicine, we're looking for the root cause of your problem, and once we determine that, our neuropathy program is non-invasive, drug-free, surgical-free approach to treating neuropathy. What we do is we use the most modern technologies available to heal nerve damage, to improve nerve function, to improve blood circulation, and to improve muscle activation. So the first thing we do when you come to the office is once we determine if you have subluxations or nerve entrapment and compression, we're going to adjust the spine and the feet. The second thing we're going to do is something called the 𝐶𝐿 therapy. 𝐶𝐿 therapy is an amazing therapy. What it does is it's an electrotherapy that creates deep contractions in the hands and the feet, and as a result improves blood flow to damaged tissue, and the electrical signaling improves the electrical signaling of the nerves, and it also improves muscle activation. Now when we're done with that, we're going to go to the Bedrock Sciences ProLight therapy. And what that is it's an FDA-cleared medical device that uses certain frequencies of light to improve tissue damage and damaged nerves. Now when we're done with that, we're going to go to another FDA-cleared medical device by Bedrock Sciences called PEMF. That's Pulse Electromagnetic Field Therapy. And what that does is, it's an amazing therapy. What it does is it creates an electromagnetic field around the cells of damaged nerves so the cells can repair. It's truly amazing. When we're done with that, we will do something called neuromuscular re-education. The reason why we do this therapy is because when people get older, they start and have no sensation in the feet, they start falling. So we do exercises that will stimulate the patient to have better coordination and better balance so it prevents falls. Now we're done with that, we will look at your blood work. We want to make sure that your sugars are not high, so we monitor your blood sugars, because sugar, as we mentioned before, will create tissue damage. When we're done with that, we're going to look at where you're deficient in vitamins, because there's something called nutritional deficiency neuropathy. So we want to make sure you're not deficient in the B vitamins, the E, and the copper. And we might make a custom IV therapy for you based on the decrease in nutrition. When we're done with that, we're going to use certain CBD topical products to help heal the neuropathy. Now, I just want to show you what this looks like. So this is a 𝐶𝐿 therapy that we do at our office. And here you can see one of our clinicians working and wrapping the feet with this patient that has neuropathy. And as we're going down through this is what's called the PEMF unit, where they create the pulse electromagnetic field, these boots, which is truly amazing to help repair damaged nerves. And it also has light in the 600 and 800 nanometer range, which is research shows heals damaged nerves. And here is a gentleman using the Bedrock Sciences boots with the PEMF and the light unit. As we continue, like I said before, we do the vibrational therapy, which is a form of neuromuscular re-education to create balance in the patient so they don't fall, and it increases sensation to the feet. And as we continue, we use certain products and topicals to help heal the neuropathy, certain CBD products with other beneficial oils. And like I said before, we always want to monitor your blood and your blood glucose levels and your A1C, just to make sure that you're in normal range. I'm Dr. John. I look forward to seeing you in the next video.